This is a very exciting time in the area of pulmonary medicine because with the emerging technology that we have here and the triple boarded physicians and the specialists, we are growing as a leader in pulmonary medicine.
Healthcare is constantly changing, and there's new technologies and new services that we're able to bring to this community, and it makes it a very exciting time for us. And this year we've actually been featuring some major advances in pulmonary care. The treatment of patients with respiratory illness. And this year, with the recruitment of critically trained pulmonary doctors, and they're bringing into our community new procedures and new therapies, the patients in this region are being treated for things we could never treat in the past. Bronchial Thermoplasty, a treatment for asthma. EBUS, which is an ultrasound technology to help diagnose cancers and lung cancers much sooner whenever the nodules are so much smaller and can be treated. It was very exciting for lung cancer patients. And GPS technology to help guide the doctors through the lung to find where these ailments might be and to treat them whenever they're at their simplest stage.
So this new technology, superDimension, is relatively a new technology. The best way to understand it, if you're not a pulmonologist, would be it's similar to a GPS in your car. The lung has 23 divisions in it, so the best way to imagine it is you're going on a road and you have to make 23 right turns sometimes to go to the same lesion. So those 23 turns, we had in the past the bronchoscopy, so you could visually look up to maybe, like, let's say 10 turns. After that, you can't look anymore because your scope is bigger than the size of the airway. superDimension allow you to advance a sheet, and that sheet could be guided using the GPS system that reconstruct your lung in a 3-dimension way. This way you could guide all your instrument exactly to that spot in the lung, giving you 80 to 90% positive yield on your bronchoscopy, a significant jump compared to your typical bronchoscopy. At the same time, since you know exactly where you are in the lung, you would probably have a lot less chances of developing complications such as pneumothorax, which is an air leak around the lung.
Like plastic surgeon changes the shape of skin, it is to change the shape of the bronchial tubes. Asthmatics have narrow bronchial tubes, and usually early asthma, they are like reversible. They go into a spasm, they narrow down, and then they open up. So during the narrowing of the airway, people can't breathe. They can't get enough air. But when the attacks come very frequently and the swelling in the bronchial tube becomes almost semi-permanent, then the bronchial tubes become so narrow that it becomes a continuous phenomenon of shortness of breath, where they feel choked because their bronchial tubes are so narrow. It's like breathing through a little straw.
I felt like my life was over, and what was the point of me being here, you know? You never knew when you were going to have an asthma attack that you couldn't get over, that you would have to call an ambulance.
So to suppress those muscles, we need something to make them, elongate, become softer. So what we use a radio frequency waves which carry energy, and that energy can bypass the inner lining without burning it. Heat and the energy goes into the muscle and into the glands and kind of partially suppresses them and destroys them from doing what they are doing in excess.
And the next day, I had no after effects at all. I mean, I was breathing good. It felt like a miracle to me.
1/3 of our lung function, probably more than 1/3, probably 40% of our lung function started showing improvement after the first session.
EBUS stands for Endobronchial Ultrasound. The lung sits there within your chest, and there's vessels, and there's the heart, and then there's your esophagus, and then there's lymph nodes.
Ultrasound is just like any equipment you use. Like for a belly, you use ultrasound to look for gallbladder, spleen, kidney and liver. In the same way, the ultrasound device, which is like a little probe on a bronchoscope, you can look around the area of the windpipe and the bronchial tubes for any abnormality. And the abnormality is usually you're looking for a lymph node.
So we could see that lymph node, we could see that vessel, we could see the flow within the lymph node, within the vessel, and know exactly when we advance our needle into that lymph node, so we can see our needle going in the lymph node when we're taking our biopsies. This allowed us to feel a lot more confident taking these biopsies and being aggressive in biopsying these lymph nodes and making multiple passes.
So what in the past we used to do, we used to put a needle in it and probe into the bronchial tube and aspirate for cancer cells. The success rate was poor because there was no visual guidance.
With this technology, the risk-benefit ratio with doing these procedures has significantly shifted toward possibly earlier intervention.
That there is less morbidity, less, mutilation of the patient. Like if you are digging in, you make 6 needle punctures in the bronchial tube and you may get 1 hit correct, but with a EBUS you might get 5 out of 6. With superdimensional you may get maybe 5 out of 6 too, with a different technology.
A little over a year ago, we opened a new OR. And with that coming, you want to use all that technology that you can, and you want to bring it here. You really kind of want to show it off. And the fact that these physicians have come to town and these volumes have grown and people are realizing that we can offer it here. And it's made a big difference.
We are a small town hospital with a big town mentality because we feel that the technologies, as they evolve, they enable us to do the things you could only receive in a major academic center in the past.
So we always kept up to date and ahead of others, not forgetting that we are a small town, but we thought we are in part of America. Anywhere you can be the top. Most of the great scientists came from garages of Pennsylvania. So why not a small town like Newcastle can bring its popularity in certain field by putting an effort.
When you have the expertise of these triple boarded specialists right here in your community, and we're offering the latest technology that all of the bigger institutions are offering, and you can do that right here without driving down the road. And even in our critical care area, where normally we would stabilize and ship those patients to a bigger facility, now we're keeping those very acutely ill patients here and treating them very successfully and having great outcomes.